Great. Hi there. I'm Deanna, a nurse practitioner student here at Youngstown State University. And you are?
Mike Moore.
Hi, Mike. We're going to get started today by doing a skin and a head and neck assessment. Everything we're going to go over today is completely confidential. Could you just state your full name, first and last?
Mike Moore.
And your date of birth?
4683.
Okay. Do you have any questions before we get started?
No.
Okay, so we're just going to start by doing a skin assessment, and I'm basically just visualizing over your skin, looking for any areas that aren't intact, any abnormal spots on your skin. Everything on your face looks good. I'm going to look at your arms now. I see some freckles on your arms bilaterally. Nothing that looks concerning. All looks appropriate size, color, and shape. I'm going to go ahead and just look at your hands. It does appear that you have some calluses on your hands, but I remember from your physical history, you mentioned you work in construction, so that's normal finding. Then I just want to go ahead and just check your temperature. So I'm just palpating, you're nice, you're warm, no moisture noted, no oiliness, non-odorous. I'm going to go ahead and just move on now to your scalp. It looks like the scalp, appears to be a receding hairline. How long would you say you had that?
Couple years.
Couple years, okay. And then what I'm gonna do is just kind of like look in your hair. It feels that it's coarse. It feels it looks like there's some gray in there. There's no lesions. There's no dandruff noted, and no parasites. Okay, and then one other thing I want to check too is just your turgor. So I'm going to go ahead and just pinch a little bit of skin right here, and it recoils quickly, and that's basically just checking for elasticity, and that yours is good, and yours went back immediately, so no concerns there. Okay, and then we're going to go ahead on to the nails. So can I go ahead and see your fingernails for a minute? So your fingernails look well groomed. The nails look pink. They're smooth, no drainage, no discharge. I'm just going to go ahead and press down, and the nail bed is adhered to the nail. When I press down on your nail, it returns from pink to white very, very quickly, less than 3 seconds. So good capillary refill, good vascular intact. Okay, now I'm just going to go ahead and palpate your scalp and your head. Your skull feels normocephalic, no depressions, sunken areas. Okay, good. And then I'm gonna just look at the symmetry of your face. Can you go ahead and smile for me? Okay, good. Everything looks nice and symmetrical. And let me go ahead and just check your frontal and maxillary sinuses. So I'm just gonna go ahead and press on your sinuses here. Any pain or tenderness?
No.
Okay, I'm gonna do the maxillary next. Any pain or tenderness as I'm checking on your sinuses?
No.
Okay, good. All right. I'll go ahead and just look forward. I'm just kind of looking at your neck here. Good. Everything looks midline. I don't see any abnormalities. Go ahead and just rotate your head to the side and then to the other side. Good. Now I'm just going to look at your trachea. I'm going to kind of push it a little bit to the one side and off to the next. It appears normal, midline. And we're going to go ahead and assess your thyroid. If you could go ahead and turn to the camera for me, Mike. I'm going to go ahead and just stand behind you, and you're going to feel my hands here. Any pain or tenderness as I'm palpating your thyroid?
No.
Okay. And I do not feel any nodules. I don't feel any enlargement. It appears to be appropriate size. Next thing I'm going to have you do is I'm going to have you take a sip of water as I'm palpating your thyroid here. Okay. And I could feel the hyoid and cartilage move up as you were taking a sip of water, which is a normal finding. Okay. Now we're going to go ahead and check the lymph nodes. So what I'm going to do is you're just going to feel my fingers kind of circling around you, and I want you to tell me if you feel any tenderness as I'm doing this. So I'm going to go check the preauricular, the postauricular, the submandibular, the submental, and then I'm going to do the interior cervical and the posterior cervical. And then go ahead and turn your head to the side for me, Mike. And this is just the deep cervical, and then the supraclavicular and the infraclavicular. And then I'm gonna do the occipital. Okay, any tenderness?
No.
Okay. No enlargement felt as I was assessing your lymph nodes. Next thing I'm gonna do is just listen to your temporal artery and listen for some bruits. Okay, no bruit. No bruit. And then I'm gonna listen to your eyes. And I'm gonna listen to the thyroid. Okay, no bruits noted. Okay, let me just go ahead and I'm gonna put my hands right here. We're gonna test for the temporal mandibular joint here. What I'm gonna have you do is just open and close your mouth for me. Good. Any pain, tenderness as you are doing that?
No.
Good, and no crepitus noted. All right, next we'll do the vision test. So I'm gonna go ahead and give you this card. I want you to hold this about 14 inches away. This is just to test your visual acuity and cover, go ahead and cover your left eye and try to read the very smallest line you can read.
426739.
Good, and your other eye?
426739.
Good, 20/20 vision, and I'll take that back from you. All right, now we're gonna go ahead and check your visual field. So go ahead and close your left eye or occlude it with your hand. Just tell me what numbers I am holding up and when you can see my fingers.
2.
Okay, and then cover your other eye and just tell me how many fingers I'm holding
3.
and when you can see them. Good. Okay, I'm gonna go ahead and just kind of inspect your eyebrows. They look good, no crusting. The eyelids look good, no swelling, no drooping. They look symmetrical. I'm gonna go ahead and just look at the conjunctiva and the sclera. If you can just look straight ahead for me. Okay, the sclera looks nice and white and moist. Same on the other eye. I'm gonna just pull down on your eyelids here. Conjunctiva looks nice, pink, moist. The lacrimal duct looks pink, moist. No drainage noted. Okay, conjunctiva looks pink, moist, and the lacrimal duct also is pink, moist with no drainage. No foreign bodies noted either. So what I'm gonna do is I'm just gonna bring the light and I want you to look straight ahead of me for a minute. I'm just gonna check to see if there's any pupillary defect. So go ahead and look straight ahead. Good, and as I shine the eye in your left eye, it's directly constricting where the right eye is concentrically constricting. Good, and same with that eye. All right, so I'm gonna go ahead and just hold this light, and what I'm gonna do is I'm gonna have you just follow it. Good. All right, and then the irids look green. No foreign bodies noted. We're gonna just check your extraocular muscle movements now. So I'm gonna just check a corneal light reflex, and I'm just gonna hold the light away, and I can see the light symmetrically in both eyes. So that is a normal finding. And then we're just going to go ahead and do a cover uncover test. So I'm gonna have you put this here on you, cover up your right eye, and then go ahead and uncover. Good, and that pupil is reactive, and then go ahead and uncover. That pupil is reactive as well. Normal finding, and then we're gonna go ahead and do the cardinal fields of gaze. So I'm gonna have you just I'm gonna hold your chin here, look at my finger, and just follow my finger. Good. So that is just telling us that the cranial nerve is intact, specifically cranial nerve 3, 4, and 6. All right, I'm gonna go ahead and get my ophthalmoscope just to go ahead and look at your eye here. So what I'm gonna do is I'm just gonna come in at an angle. I'm gonna have you look straight ahead for me, Mike. And as I look in here, I'm just looking for the red reflex, which I can see. I'm gonna go ahead and just keep coming in. All right, good. And the retina appears to be a yellow color, and the veins are definitely larger than the arteries. I don't see any AV nicking. I don't see any cotton wool spots. I'm gonna just come straight ahead. The macula looks like a dull light color. Good. And the lens looks clear. Okay, and the depth of anterior chamber is appropriate. Next, I'm just going to do an inspection of your ears. I'm just going to look at them, and they look nice and symmetrical. They look pink. They look appropriate. No discharge. Any pain as I tug on your ears?
No.
Okay, I'm just going to kind of palpate down your ear. Any pain or discomfort?
No.
Okay, good. All right. Next, we are going to do an ear exam, and I'm going to go ahead and just look inside your ear at the inner canal here. So let me just come on this side here. I'm gonna just kind of pull your ear up and back and take a look here. Let me know if you have any tenderness as I'm doing this. Okay, and there is some cerumen present, no other discharge. The tympanic membrane is nice, pearly white, translucent. I can visualize the corneal light cone reflex. Also, there is some bony prominences present. Okay, next we're going to do a couple different hearing tests. The first test is called the Weber test. So what I'm going to do is I'm going to activate the tuning fork and put it on your head, okay? And then I just want to know where you hear the sound. If it's both ears bilaterally, or if you hear it on one side more than the other.
Both.
Okay, good. All right, the next test is called the HEENT test, and this test is for air conduction versus bone conduction. So I'm going to put this right here. Can you hear the sound?
Yes.
Okay, tell me whenever you can't hear it any longer.
Okay.
Okay, and then can you hear the sound?
Yes.
Okay, let me know when you can't hear the sound any longer.
Okay.
Okay, all right, good. And then I'll go ahead and do the other side as well. Okay. Can you hear the sound?
Yes.
Okay, tell me whenever you can't hear it any longer.
Okay.
Okay, can you hear the sound now?
Yes.
Okay, tell me when it stops.
Okay.
Okay, so that's just confirming that the air conduction is 2 times longer than the bone conduction, which is the normal finding. Next is the whisper test. So I'm going to have you cover your left ear first, and I'm just going to whisper a few words to you.
Oh.
Child.
Child. Dog.
Good, and then cover your other ear.
Pumpkin. Apple. Pie.
All right, you're okay. And then next, I'm just gonna kind of look at your nose here. The alignment looks symmetrical. I don't see anything externally. Everything looks nice and intact. I'm gonna just palpate now. Any pain as I'm palpating around your nose?
No.
Okay. I'm gonna go ahead and just look inside your nose. If you could just tilt your head back for me, I'm going to just take a peek in here. And I do not see any perforations, no swelling. It looks nice and pink. The turbinates are not swollen. All right, nice and pink on this side, no discharge, no perforations. The turbinates are not swollen, no drainage, and no foreign bodies in there either. No deviated septum. And then I'm gonna go ahead and just take a look at your mouth now. Looks like your lips look nice, smooth, intact. Go ahead and smile for me and just clench your teeth together. All right, so it looks like you have proper occlusion of your teeth. Can you just go ahead and open your mouth a little bit? Okay, I don't see any missing teeth. Is that correct? Have you got all your teeth? Open, mute your tongue just a little bit for me back. All right, and then Go ahead and just open your mouth a little bit there. Okay, your gums look nice and coral pink. I don't see any redness or swelling. Go ahead and open really wide for me. Stick out your tongue. Good, no coatings on your tongue. Your tongue looks pink. It looks symmetrical as you're sticking it out. Go ahead and open real wide now. All right, and then just say ah. Okay, as you say ah, your soft palate rises. Your uvula just stays midline. It looks nice pink. No drainage. No concerns there. The mucosa looks nice pink. I am going to ask you, did you have your tonsils removed?
Yes.
Okay. Let me just look one more time. Looks like the posterior pharynx is nice and pink. At this time, I would go ahead and just kind of like poke at it and elicit a gag reflex, which is present. Okay. Do you have any questions, Mike?
No.
Okay, well, I thank you for your time and appreciate you taking the time to do this assessment.
Thank you.